The central concern that I hope and pray that religious voices will bring is concern for the poor and the suffering across the world. They have power, they have a broad mandate, and what we hope to see is a sharp focus on refugees, on vulnerable children, the millions of children who've lost caregivers in the COVID pandemic, and so many other minority groups and others who are suffering. It is our view that the G20 should be giving a priority to those communities in the world. That is their responsibility, but it's also within their mandate and their power. Two interesting changes and insights that come out of the COVID pandemic experience are the vital importance of governments. People have been cynical about governments for years, but there is a recognition that governments are essential, even more in times of crisis, with public health, but even beyond with social protection for populations. So the essential role of governments has been reinforced. But the other one is the essential role of religious communities for many, many different reasons. We've even now started talking about religious leaders and communities as essential services that have a distinctive role beyond civil society that has not been recognized in the past. So that includes, of course, spiritual care, focus on the mental health issues that have been so much of a concern during this pandemic and growing, but also practical social protection, feeding the hungry, providing some compensation, some support for education, which has been driven online. Community, a sense of community. So a whole host of different things. But what that presents is the very real question, which will differ by country, but which is still a common thread of how do governments and religious communities relate to gain the benefits and also, of course, to deal with the flaws, the bureaucratic nature of governments and some of the negative aspects of religious communities. So we think that we will be seeing a reshaping of government-religion relationships as a result of the pandemic.